you guys had that we didn't get a chance to answer last time. Just to remind everyone, we are in a real operating room with the ventilator, with the little breathing bag, with the anesthesia gases, even with some liquid IV anesthesia. And I wanted to answer some of the questions that I was emailed last week, in particular about how you wake up, how long you can fight anesthesia, post-operative delirium and shaking and kicking and screaming and crying. Why does it happen? And I also wanted to talk just a little bit at the end about how your body opens up under anesthesia when you're on the operating room table under these lights in kind of that vulnerable, stressful situation, how your body opens up to tell us secrets about itself that you've probably never told anyone else, maybe never even admitted to yourself, things like anxiety and depression and other mental health struggles that are really important, not only for your personal health, your mind and body health, but even for how you are at work, your productivity at work, your relationships at home, and so much more. And yeah, it's crazy. The operating room and anesthesia here actually can tell you a lot about your body in ways that you probably never thought possible. So I see a whole bunch of, wow, so many awesome comments. Hello, everyone. Hello, hello. I'm actually holding the phone right now so that I can show more of the operating room, so I hope it's not too shaky. Let me know if it's too shaky and I can put it back on this little tripod. Hey, Brenda, good to see you again. All right, so the big question that everyone always asks, this is what I was emailed so many times last week. Why do some people wake up delirious after anesthesia? Like, anesthesia puts you to sleep, right? You should be calm and relaxed. But why is it that you wake up so agitated? And I'm not going to tell you how many times people have tried to swipe at me or swipe at a nurse or someone else in the room. Why does it happen, right? First of all, it doesn't happen to everyone. Oh, by the way, so many great comments, guys. Thank you so much. Kelsey, Kelsey, thank you for the kind comments. Do please feel free to reach out to me. I would love to help you with that. So, like I was saying, well, Kelsey, by the way, commented because I'm a public speaker as well about the hidden potential that comes out when you're under anesthesia, all the secrets that we're going to talk about at the end. But Kelsey, yeah, thanks for reaching out, and definitely we can be, love to help you with that. All right, why do you wake up kicking and screaming in this operating room? It has to do, in part, because anesthesia turns off the parts of your frontal cortex that would ordinarily stop you from doing things that are cringy or outlandish, because the frontal cortex inhibits you from doing those inappropriate things. But you turn that off because anesthesia turns off nerves and neurons in your body, including these ones. Some of the first to go are up here. Eventually the rest of your neurons and nerves turn off, like the ones in your heart, your muscles, your bladder, etc. But first is going to be up here. Number two is that the way that patients fall asleep when they enter this room here, they come in through the door, they come onto the table here, they see the lights, they see me. These can all cause anxiety, totally understandably in patients. That anxiety has a physical manifestation. The more anxious you are, the more anesthesia you need. The more likely you're going to be to fight it. The more likely you might be to remember something from your anesthesia experience. It also influences how you wake up. Now, other things can also impact delirium. The medications that you take before you have surgery can impact delirium. If you have pre-existing dementia, that can cause delirium when you wake up, because anesthesia scrambles your brain even more. If you're a young child, you're more likely to wake up with delirium, like if you're 1 or 2 or 3 or 4. The kicking and screaming stuff, everyone's a little bit different, but if you're in pain, if you have low oxygen or high carbon dioxide, those can also contribute to your brain being a little bit more unhinged than it ordinarily would be. But the thing that you can control most in this operating room is going to be your mental state before you go to sleep. That impacts your pain when you wake up, impacts usually how relaxed you are before, during, and after anesthesia. Great question there. How long does that last for was the follow-up. So how long might you be kind of zoned out? Depends on the type of anesthesia you got, how long your surgery was. In general, the longer your surgery is in the room, the longer it's going to take for that anesthesia to wear off. There are exceptions. Some anesthesia agents wear off very fast. Most of them they build up in your brain, and then it takes time for them to come out. If it's anesthesia gas, like the one coming out of the ventilator, You have to physically breathe that gas out if you want to wake up. If it's liquid anesthesia, it has to redistribute out of your brain into the other fatty tissues in your body, because your brain is very fatty. These are fat-soluble medications, so they have to go into other fat deposits in your body and in lean body mass as well, like in muscle tissue. Great question. Okay, how long does it take to fall asleep? And can you fight me? Has anyone ever won? And I will tell you right now, no one has ever won. Whenever patients try to fight me, as the anesthesia mask is going on, I always remind them that I never lose. Anesthesia always wins, because if you have a brain and you're able to talk and walk, you have GABA receptors, you have NMDA receptors, you have all sorts of brain receptors that have allowed you to live this far in life. And these medications all turn those off to varying degrees, depending on the specific agent. And you can't have a brain and be immune to anesthesia. Doesn't work. Okay, so many great questions. If delirium is caused by multiple things, can benzos prevent it or worsen it? Jay, benzos, like I have a sticker for one of them here, midazolam or Versed, make it worse. It further disinhibits your brain, so you do more silly, cringy, outlandish things. Great question. All right. Wendy woke up during surgery. So another good question. Why do some patients wake up during surgery? When you're on this operating room table, usually, depending on the type of surgery, you're going to be either in a sedation or fully asleep. If you're fully under general anesthesia, most times you get a breathing tube. This is one example of it. I'm happy to show you more if you'd like. Just let me know. This is called an LMA. I use it very commonly because it's just so much gentler on the body. For the right surgery, I like to use the most gentle anesthesia. In general, I like to use as little anesthesia as possible because that has the fewest chance of side effects. In the case of the breathing tube, you have less chance of vocal cord damage and sore throat and dental damage, etc. So if you wake up in the middle of surgery, if you have this in your mouth, you won't be able to say anything. So most times when people say they woke up, they said they said something to the surgeon or the anesthesiologist and they went back to sleep. So if you said something, it means you couldn't have been under general anesthesia with a breathing tube because you wouldn't have been able to speak if that thing was stuffed in your mouth. So you were under sedation, oftentimes with a medication like this, or with a combination of stuff like this. In which case, you were never really fully asleep to start with. You just kind of came out of a sleep and then went back to it. But you weren't under general anesthesia. So the expectation of being fully asleep is a little unrealistic. All depends on the type of surgery. Endoscopies, colonoscopies, foot and hand surgeries, you're usually not under general anesthesia. But for lung surgeries, heart surgeries, etc., yeah, you're going to be under anesthesia with a breathing tube nearly all the time. All right, so how long does it take to fall asleep? Usually it's seconds. Depends, once again, on how I use these medications. We have things called rapid sequence inductions in high-risk patients. And high-risk patients, I want them to fall asleep right away if I'm worried about them having a full stomach. Like if they are a trauma in the emergency room and they weren't appropriately fasting, we got to go to sleep right away. So I jam this medication. I push it as fast as I can. And I actually use a medication. I'm going to show it to you here. So this is my anesthesia medication drawer here. I use this one here called succinylcholine. It's got a red cap. It's a paralyzing agent. It's a very fast-acting paralyzing agent so that patients can fall asleep very fast, be paralyzed very fast, and get a secure breathing tube in as fast as possible. So in that case, it's a matter of seconds. If it's someone with bad heart disease where I want to go slowly so we don't overtax the heart, I might do it more slowly over a number of minutes instead of a number of seconds. What are the side effects of anesthesia? Rabbit hole. I love your username, but what do you mean by the side effects? Side effects of what? There's a lot of things in this operating room that can have side effects, right? Tell me which one. We'll talk about it. Okay. Can I do a live intubation someday? Yes, I would love to. How about an induced coma? What is used to sedate patients? Welly Rosa, great question. What we use for medical comas are anesthetic agents like this, like the white stuff, propofol. In some places, like in Europe, they actually use anesthesia gases to medically sedate patients. It's all anesthesia. Great question. What if a patient is heavily intoxicated? Can you still administer anesthesia? Rabbit hole, good question. For elective surgery, no. For emergency trauma surgeries, yes, and we take appropriate precautions. Good question. Okay, by the way, if you guys are learning something, do please hit that like button. Your support helps me do this more often, and I really appreciate your support here. Fantastic, especially everyone who came from TikTok. That's great to keep learning and asking questions. And remember, you guys can always reach out to me over my website. So much more information on there. And like I said, I am a public speaker, so if you love learning about the secrets about your body, what is exposed under anesthesia and revealed, you can always hit me up for speaking engagements as well. Okay, back to questions. How long before you start to remember things after you wake up? Really good question, and this is fascinating here because patients think they wake up in the recovery room. Not true. You probably woke up, had the breathing tube removed from your mouth when you were still on the operating room table. But you don't remember that, do you? It's because it takes time for the memory formation parts of your brain to be able to consolidate those memories and store them into the hippocampus to remember in the future. So you're perfectly conscious, you're breathing, you're talking, etc., but you don't remember it. You don't remember it. Crazy. I was saying in the last live session how the reason I don't remove the breathing tube out in the recovery area is because if something goes wrong, I want to have my ventilator here, I want to be able to breathe for the patient, I want to have all of my emergency medications that I showed you here. These are all only here in the operating room. If I need to place a breathing tube, I want to make sure I have my airway equipment like you see here in my drawer. I don't have access to those in other parts of the hospital. I want to have them. You only have them in the operating room. And the second most dangerous part of surgery is the breathing tube coming out. The first most is the breathing tube going into your mouth. Kind of like this one here, right? But I don't like to extubate patients outside the OR. And I mean, there's some exceptions, but in general, I stick to it in the OR. So you don't actually remember when it's coming out. It's kind of wild, huh? Kind of wild. Okay. So what is going on with this? Okay. My 75-year-old father is dealing with being very sleepy a lot since his knee replacement. Not normal for him. Thoughts? Okay, so Stephanie's asking a very good question about post-operative cognitive deficits. Meaning you fell asleep here, maybe with an IQ of like 150 or whatever, 175, whatever, and you woke up with an IQ a couple points lower, and it stayed there for a couple of weeks. So first of all, I'm really sorry that happened to your 75-year-old father. Stephanie, thanks for sharing that. We don't know why this happens to patients. We know that in open heart surgeries, because there's a heart-lung machine, there's not one in this room right now to show you, but there are blood clots that can form in that tubing when your blood leaves your heart, leaves your body, circles around and comes back. Those clots go to your brain and cause mini strokes. We believe that's what is the cause of cognitive deficits after open heart surgery. Most of them do recover fully. For hip fractures and orthopedic surgeries in older patients, we don't yet know why. We don't know if it's from the anesthesia. We don't know if it's from the actual injury itself. We don't know if it's from the surgery itself. We just don't know yet. So we're actively researching it. The best thing one can do is to always weigh the risks and benefits of surgery when you're at the extremes of age, like very, very small or very, very old, because nothing is without risk. Nothing in the world is without risk, especially here in an operating room. Everything has risks. My nerve blocks, my spinals, my anesthesia, everything has risks. This is one of them. It's on the order of 1 in 4 patients have some degree of post-operative cognitive deficits after orthopedic surgery in the elderly population. So your father isn't alone. We just don't have good reasons for why yet. It's always best to avoid medications like benzodiazepines and other medications that might exacerbate cognitive deficits or delirium. Okay. Jason's asking the difference in intubation and extubation. Intubation is the breathing tube going in. Extubation is the breathing tube coming out. Good question. Okay, guys, there's one more question about shaking when you wake up after anesthesia. Why do you shake? Number one is that we don't know why. General anesthesia causes shakes and shivers to happen, even if your body temperature is normal. Check it. When you're having surgery, anesthesia disrupts your body's ability to regulate its temperature. So we have these, here we go. We have these elephant trunk looking things here. Literally looks like an elephant trunk, right? And this helps control warm air blowing over your body. So like I said, anesthesia disrupts the body's ability to shiver, to sweat and all that. So body temperature is totally dysregulated. So we have to warm the body for the patient. So you can see here, we can select the temperature that we want this elephant trunk to blow warm air out of. So usually patients are not cold waking up if we did a good job keeping their body warm. We always measure the temperature. It's one of our standard sensors and monitors in surgery. So it's not from being cold. It's probably from something to do with the anesthesia itself. Also happens, I haven't seen data to prove this, but I do suspect that patients that fall asleep very, very anxious are more likely to wake up with just uncontrollable shivering. Animals in general, they have tremors when they are in stressful situations and they're coming out of stressful situations. It's flexion extension tremors, usually in the big muscles in the body, in the chest and the arms and the legs. And it looks very similar. Like if you tranquilize a polar bear and you see it as it wakes up from that traumatic experience of being tranquilized, you'll see it shivering the way that humans sometimes shiver and shake after anesthesia. I don't know for sure if they're related. No one knows. But I suspect there might be something there. The treatment is particular medications in this class. You guys see the blue one here? Opioids. Certain opioids can actually help fix that shivering. I don't know why. I don't know if that's just helping reset the body, helping the body relax or chill out after traumatically waking up. I don't know. But it happens very often. Very good question. So Rabbit Hole is asking, is shaking a trauma response? Some people think it is. I don't know for sure. I suspect in some people it probably is. I have a lower spinal fusion, asks Tiarna. Would this mean I couldn't have an epidural? It depends. Some places that are comfortable doing epidurals, some places they're not. For a spinal fusion, I have never done one before, but doesn't mean it's necessarily impossible, but the risks may outweigh the benefits. Okay, guys, I promised I would end by talking about how your body reveals secrets under anesthesia. And it's because this is so fascinating, guys, so interesting. I actually just finished recording a full-length video that'll go up in a week or two. But this is so cool. All these medications in anesthesia, whether it be liquid, whether it be from the ventilator here, they turn off the nerves and neurons in your body. Where do you have nerves and neurons in your body? Everywhere, especially in your brain, in your gut, but also in your heart and all the muscles in your body. The body keeps score, says Jay. That's right. Welly Rosa, oh my gosh, I don't mean to interrupt my point here, but Welly Rosa was on ECMO and remembers everything. Oh my gosh, we have to talk about Welly Rosa's story. She was on ECMO and in a coma and remembered everything. I'm so sorry, Welly Rosa. That is one of the concerns that we have when patients are lightly sedated, like on ECMO. Some patients are fully awake on ECMO, but if you're supposed to be asleep, it can certainly be traumatizing. I'm so sorry you had that, Welly Rosa. But let me finish what I was talking about here, because I have to get some sleep tonight too. But this is really, really important. Anesthesia interacts with these neurons in your body, your bladder, your colon, your muscles, everywhere. The way that anesthesia interacts with the nerves in your body depends in part on what your body's been storing in its mental health state, any traumas it's been storing, any anxiety, depression, substance use, opioids, marijuana, medications for depression, benzodiazepines, All these things affect your body in ways that are profoundly revealed when they interact with anesthesia. That makes sense. Your body opens up based on how the anesthesia interacts with those nerves that are constantly bombarded by the environment you live in. But more importantly, and this is what I want to end with, the way you may not be able to control what comes your way in life because you can't control the world around you, but you can control how you respond to it. And this is where resilience comes up, and you can tell people that are resilient in the operating room and how they wake up after surgery, because you have a conscious decision on how you react to what happens. And that's the resilience that we see in patients who wake up more calm and less pain with fewer complications after surgery in this operating room. I'm not saying it's anyone's fault to wake up with complications, no. But there is a way that when we live our lives, recognizing the control that we have consciously in responding to what happens to our body, it shows when you're under anesthesia, when you're in that vulnerable moment, under medications, when you have breathing tubes. It's like Jay is saying here, it can be a trauma. And like Jason's saying, anesthesia reveals truth. The way that your body's conditioned over years and decades of reactions and responses to chronic stress affects your body. The body keeps score. And that scorecard is shown on these monitors when you're under anesthesia. I hope you all find that it's not only fascinating and interesting, but also empowering. Because remember, the way that those anesthesia medications interact with your body to reveal those secrets is also a way that anesthesia can interact with your brain to turn off the negative self-talk parts of your brain. Not only does it turn off the frontal cortex that causes you to say cringy things and embarrassing things, but it can also turn off the parts of your brain that are telling you, I can't do this. I'm too slow. I'm too paranoid. I'm too afraid to try this. All that self-talk you can turn off. I'm not saying everyone has to use anesthesia, absolutely not. But I'm saying that we have an incredible potential to control those parts of our brain. You probably have more control to do that than you've ever been told. And under anesthesia, this is all revealed in ways that you probably never knew possible. Even if you have a breathing tube in your mouth and you're unable to verbally tell us, your body keeps score. And physically, your organs are holding on to these stressors, your heart rate, your lungs, your brain, your muscles, everything is responding to the anesthesia in a way that shows what your body's been through, particularly mentally. So I hope that you all appreciate that your body's incredibly capable of holding on to negative things from your environment, but also very capable of overcoming them, often with few to no medications, depending on who you are and your medical history. So I'll end with this. Rabbit Hole is asking, people who bury their stress are at risk when they get surgery. Rabbit Hole, to an extent, yeah. The more mental health challenges you have in the operating room during surgery, the more chance you may have of worsening depression after, worse anxiety. And these can all lead to surgical complications, anesthetic complications. The risk is not incredibly high, but every little bit of risk adds up. And if it's something that's going to affect someone for the rest of their life, I want to take that opportunity to help heal it as much as possible. If it can help them overcome a smoking addiction, if it can help them gain more insight into why they have anxiety, if it can help them reduce the risk of depression getting worse after surgery, why not take that opportunity when you're here with me? That's why I call my patients the night before surgery. That's why I like to come on here on social media to remind you all just how much power you have over your health. It's why I talk to organizations and associations. It's why I want you all to remember that you have more power over your health than you've ever been told. That said, I'm losing my voice here, so I gotta head out. But I hope everyone learned something. Please share what you learned with others. And if you haven't already, hit the like button and follow to keep up with all my lives and my other videos. I hope everyone has a good night. I'm so happy that Jay is still using the Valsalva breathing technique. Fantastic. All right. Take care, guys. Bye-bye.